Welcome to Comcast Connects. My name is Gloria Cardenas-Cadilla, and I am your hostess. You know, there are a lot of things going on in our community, and many times all we hear are the negatives. We hear about crime, we hear about this and that and the other. But you know, there are a lot of great things going on in our community, and that's what Comcast Connects is all about. We're here to bring you information that's valuable to you and your family about events, about organizations. And, you know, sometimes we just need a little reminder about things we may already know, but it's good for us to be reminded about things, especially our health. First of all, I do want to thank my husband, Frank Cadilla, who's operating the cameras here for Comcast Connects, Barbara Stucker, who owns the company Someone Cares Memorials, who does these beautiful decorations for us, and Janice Keene, who is the studio manager and works for Comcast. Because Comcast makes it possible for us to be here with you every month, bringing you valuable information, as I said, that will help you and your neighbors and your families. Today, I have a very special guest. I have Dr. Thomas Isaacson here, who's going to talk to us about information leading to prevention and good health when it comes to our hearts. Because February is American Heart Month, and of course, it's the month of love. So we thought we would just bring you a little bit more information, a little bit of awareness, and just a little bit of reminder of how to stay healthy. Dr. Isaacson, thank you for joining us today.
Gloria, it's a pleasure. It's a pleasure to be here with you.
Thank you. Thank you. I know you're a busy man. I know you have a lot of things going on, but I think that some of the information you'll be sharing with us will maybe help some people out there to maybe get a little bit healthier and maybe enjoy life to at another level.
Have to have awareness. You know, we don't mind the things that we aren't sort of paying attention to.
Exactly. First of all, tell us a little bit about you. You mentioned earlier you've been in Rockford since August, right?
Just since August.
Okay.
I moved here with my beautiful family from Pennsylvania,
Okay.
although I'm a native son.
Oh.
I'm from Rock Island, Illinois,
I
and
see.
my brother and his family are still in Bloomington. My sister's in Davenport, Iowa, so we sort of got to come home, if you will.
Oh, wonderful.
So I'm our Chief Medical Officer with Rockford Cardiovascular Associates, which is part of OSF, St. Anthony's, and we are, you know, very happy to be, you know, a contributor with the American Heart Association as far as Heart Month, which is February.
Yes, it is. And as I said earlier, I know you're a very busy person, and so, I mean, we truly, truly value your time here. You know, what better way to educate our public about the good things that need to be done and the things that sometimes we just need a little bit more reminding about when it comes to heart health than to have the experts. Tell us, first of all, why don't we start off with, I know you shared a couple of questions here with me, and what are some of the warning signs of a heart attack? I'll tell you, sometimes we hear this, we hear that, but what are the things we should look for?
And this is a confusing area because the symptoms are not always straightforward. And, you know, and many times people will neglect to think about the symptoms as being heart, and they think about them as indigestion and other things. Now, classically, of course, we talk about chest discomfort. We talk about a heaviness, a pressure, a tightness in the chest. We may, you know, have patients that will tell us about arm pain or jaw pain. Sometimes they feel as if they're breathless. They can't catch their breath if they're doing something. So I tell patients a lot of times about anything from your belly button to the tip of your nose can be heart pain. And sometimes it's very difficult to distinguish what is heart pain and what is something else because of the way it's sort of connected and the way our brain interprets.
Okay, sure.
So a lot of times what we have to do is just have that awareness of, well, what's going on here? And if they need to, we encourage people to have it checked out.
Sure, absolutely. Now, a lot of times you hear about, you know, heart attacks, but then cardiac arrest. What is the difference, and how do we know which is which?
Right. You know, cardiac arrest is when, you know, we think about things like CPR. You know, we think about when we see things on TV when they're using the paddles to shock someone. So the cardiac arrest, and it can happen, of course, anytime, anywhere, and happens in our community, on a street, in a restaurant, and places like that. It is important, again, to have that awareness when someone goes down and they are unresponsive like that we need to initiate that CPR and do it rapidly. Now, along with that, you got to be hollering out, call 911. Or you assign someone, Gloria, please call 911. but someone else then starts CPR immediately on that patient, and then obviously EMS services is going to attend to that patient and get that patient to the hospital quickly.
Of course. Wow, such a simple detail that can be overlooked, that could be a matter of life and death. As
Absolutely.
you said, just hollering out, call 911.
And 911's the key.
Right, right.
You just have to activate that system, get people coming to help, and then really attend to that. And it's just the good, solid CPR that is really important to how we can help patients like that in our community.
And I think a lot of times, too, people may feel a little bit hesitant to do the CPR because they hear about these lawsuits and everything, but at the same time, it's better to at least start something than to just not do anything at all.
Absolutely.
I would imagine.
It makes a huge difference in terms of the chance that that patient is going to have a good outcome.
Exactly, exactly. Now, as far as high blood pressure, why is that an issue? Why does it matter?
Right. Why do we talk about high blood pressure so much? Well, the attention-getting piece can always be, it puts us at risk of having a stroke. And I think when we think about that can be fairly devastating for people. High blood pressure affects the way the blood vessels actually work, and consequently it injures them to where they don't function normally. And it's a very harmful effect on the blood vessels, consequently putting us at risk of things like stroke or like heart attack. So you're right, need to know those numbers, need to get the blood pressure checked, that is something not to neglect because it's so treatable.
Yeah, and you know what, a lot of times when you hear about high blood pressure, you hear, well, cut the salt, don't do this, don't do that, but it's like, okay, we're told about what not to do. What are some of the things that we should do or maybe focus on to make sure that we keep that blood pressure at a normal level? Can you give us a couple of tips on that?
I think that salt is a big piece, and that we do need to be cognizant and label readers. So we need to know what's in that can of soup. When we go out to fast food, how much salt am I actually getting?
Right.
Because salt is in everything, and that's a real challenge. And we know that sometimes, a large consumption of salt is going to raise that blood pressure. Now, some other simple things. Exercise, watch your weight, pay attention to that because those all contribute to high blood pressure. So does alcohol use in excess, so does smoking. All of those things have a relationship again, which comes back to that vessel health.
Exactly. Sometimes I think when, or at least I used to in the old days, when I would hear the word exercise, it's like, oh my gosh, how am I going to lift 300 pounds and all that? But something as simple as walking. My husband and I are mall walkers. We love to go out to the mall. The only downside is I like to shop while I'm at it, but something as simple as starting a walking program, I would imagine would
Gloria,
be...
maybe you can just window shop and, and also maybe do the walking. Maybe that'll be how that can work out.
I'm working on it.
The walking is key. People talk about, and if you watch TV, you probably can't help but hear about 10,000 steps a day.
Right,
and
right.
that ability to really have, increased activity and not just to be sitting, not doing anything, and walking's a simple thing we all know how to do.
Right. Now, we have about a couple of minutes left. Certainly, we need to reduce our blood sugar. But you mentioned something about Life's Simple 7.
Right.
Tell us what that is as
Right.
we're winding down our interview.
Well, I would have everyone try to go to the American Heart Association website. The American Heart Association has some very practical, simple things that we can all do. I sort of refer to them as kind of mom's rules a little bit.
Okay.
So let me make sure I get them all, because there's 7. All
Okay.
right? So, you mentioned walking, get active.
Sure.
Okay, that's key. We need to know our numbers because we do need to attend to our blood pressure if it's high. Again, cholesterol is another piece of the equation, and another, something to know, and we need to control our cholesterol. If people smoke, have to stop smoking. That's really critical.
Right.
And we have to lose weight, pay attention to our blood pressure, and eat better. Less salt, better foods that are not simple carbohydrates, and a variety of foods.
Exactly. When we hear about eating better, sometimes it's like we hear it, but we don't know how. And I think a lot of us have read how, here's your plate of food. Instead of a great big old steak, certainly everybody, will say, ooh, I'd like, but it's kind of like cutting that down and increasing the vegetables, and
Right.
just something as simple as that could make a big difference, I would imagine.
I think that's absolutely right. If we sort of all good things in moderation is probably a good way to think about that. And then Mom's suggestion to us of, we do need to have some fruits and vegetables be part of our diet, and doesn't mean we can't have meat. It just means that it needs to be sort of a smaller portion.
Exactly.
And not that huge, slab of steak.
Right, right. Now, you had mentioned the 7, and so as we're talking about these, it's basically common sense. When you hear about some of these things.
These are things that we can all take control of. I can't control my genes. I can't choose my parents, but I can take control of these things that are part of my, again, lifestyle.
Sure.
The choices that I make about food, like you're suggesting, the choices that I make to stop smoking or not start, to get my blood pressure checked, to know my numbers of cholesterol, to have that discussion with my physician. Those are all things that we can take, action to do something about on a daily basis.
Exactly. And as we've started a new year, this being February, it's pretty much a time to, when we make resolutions, we're going to do this year and all of that. But a lot of times it's like, well, I'll get to it. No, today. Today is the day. What's for supper tonight?
Right.
What are we going to add? Extra slices of tomatoes or something, fresh living food. It starts now, right?
I think that you're right. We always tend to, we're pretty good at putting things off, or I'll do it, next week or next Tuesday or things like that. But really, these are simple things. I mean, like you said, even just to be simply more active, that just means maybe walking a little bit, maybe taking the stairs if the knees will take that. Doing those kinds of things that every day, contribute to our wellness, contribute to our health.
Exactly. As we are winding down, we have just a few seconds left. Is there a message that you have for our viewing audience? If you'll just take a look at the camera and say, folks, what is your message from your heart?
Well, February is Heart Month, and we're very fortunate to have, that as a focus on the fact of looking after our health. And health is not just about all of these things, it's also about looking after and having in your life your loved ones and caring for yourself on a regular daily basis. And that really is what health is all about. So all of these things can be done, as Gloria has suggested, on a daily basis.
And that's what it's all about. Dr. Isaacson, it's been such a pleasure having you here. Thank you so much for taking the time.
You're welcome.
And I hope this won't be the last time. I hope you will come back, not just at Heart Month, but again, because as you mentioned lowering our blood sugar, sometimes it's like, well, how do I do that?
Sure.
And it's like, so sometimes we just need to be reminded more often than not on how to be healthy, right? Great. Thank you again, and I hope to see you soon. Okay?
Wonderful.
All right, and thank you for joining us on this segment of Comcast Connects. Remember, if you have some information or if you have a program or services that you'd like our public to know about, please contact me. My cell number is 815-289-5970, or you can send me an email to gloriacudia@comcast.net. Thank you again, and have a spectacular day. Bye-bye.